Well, hello and welcome back to CERT Basic Training. Today what we're going to talk about is hands-on training. Okay, we're going to talk about the head-to-toe assessment. We're going to demonstrate how to open an airway, and we're going to demonstrate the recovery position. First, we will start with opening the airway. As you remember, when you approach a patient, you want to make sure that they can see you. Okay, introduce yourself, identify yourself, and ask for permission to treat them. Sir, my name is Fernandez from CERT. Can I help you? Okay, the patient is not responding, which means this is implied consent that I can help him. So what I'm going to demonstrate now is a head-to-toe assessment. Just so you know, you should always have your PPE before you approach your patient. I just wanted to demonstrate that or talk about it, but I'm going to put on my gloves. As a minimum, if you're doing any medical type assessment, you should always have at least a pair of gloves on. In addition, you should also have your mask that can protect you in case there's any airborne or bodily fluids that are flying around the patient or coming out of the patient. You don't want to touch that or get that in your face. So remember, once again, when we talk about opening the airway, it's a technique, and it's called the jaw thrust. And the reason we use that is in case this patient may have a neck injury. In this case, I have to assume that because they're unconscious. So we move to the head of the patient. You grip the side of the patient's head, okay? You put your fingers underneath the jaw, and you press down essentially on the cheekbones. And as you lift up with that, it is going to pull the tongue away from the back of the throat. Remember, what we learned is that in an unconscious patient, the most common obstruction is the tongue. The structure falls back. So by doing that, as I open that, it forces mouth open, and I'm listening, and I can hear the patient breathing, and I can see the rise and fall of his chest. That is the jaw thrust method for opening an airway. Okay. At this point, my patient is conscious. Okay? He's breathing on his own. I'm still going to do the same thing. Again, this is a head-to-toe assessment, which is going to be done inside of the treatment area. This is after we've already triaged the individual. We've already treated life threats. Remember, we had the ABS, the airway, bleeding, and shock. And we treated those outside. This patient is stable enough to, again, where we can conduct this head-to-toe assessment to look for additional injuries and treat those injuries for this patient. So as stated, it is head to toe, and you're going to work systematically. We're going to start at the head. We're going to look at the neck. We're going to do the chest. We're going to check the abdomen. We're going to check the pelvis area, and then we're going to do each extremity. Finally, we will roll that patient over and check the back. We had another individual to assist us with that. If you also remember, we had an acronym. It was DCAP, BTLS. And that stood for deformities, contusions, abrasions, burns, okay, lacerations, tenderness. Now, if you also remember, we talked about it's not something that you absolutely have to remember, that entire list. Most people aren't going to remember that. However, all of us know what a patient or person, what they look like in a normal state. So if you're checking an individual or they scream out in pain, you know something's wrong. And you need to check that. You're going to see a bruise. You're going to see a burn. You're going to see a laceration. You're going to see a contusion. Okay? We all know what that looks like. So if something looks out of the ordinary, that's what we want to identify and write down during this head-to-toe assessment. So I'm going to start with the head. Move my weight back over. And I'm going to feel around the person's head, all the way around, even around to his neck. Okay? Going to feel for, remember that word crepitus, any movement of bones. It feels like Rice Krispies. I'm going to look at the patient's eyes. I'll make sure that they look equal, that there's no blood or anything there. I'm going to look inside of their nose, make sure there's nothing coming out of there. I'm going to open his mouth and look inside of there. I'm going to look inside of his ears. And remember, after I do that, I'm going to look at my gloves, because we're looking for blood. Every time you finish a section of the body, you should look at your hands for any blood. You don't want to get all the way down the body and look at your hands and wonder where blood came from. You would have to start over. So, as I check that, I don't see anything. Sir, did anything hurt you at all when I was doing that?
No.
Okay, so you want to talk to your patient. And you want to say that up front. I'm going to check your whole body. If you feel any pain or tenderness, please let me know. Okay? So the patient's going to talk back to me and tell me that. So I'm looking and I don't see anything. Okay? I am then going to move, again, to the neck and chest area. So remember, we're going to check the back of the neck. No tenderness there, sir?
No.
Okay? I'm going to look at his neck, see if there's any bruising. I don't see any. Going to then push down on his chest. Okay? Push down on the sides. If this was a female, take the middle of your hand and go down like this. Okay? You're checking the sternum. Never like this, and that's for obvious reasons. Okay? But I'm checking there. Sir, any pain there?
No.
Okay. The other thing you want to do is you want to observe your patient. You want to look at their face. If something hurts someone, typically they'll wince. So besides them telling me that, I'm going to look for that. Next, I'm going to come down to the abdominal area. And remember, the abdominal was broken into 4 pieces. You could take the belly button, you can draw a horizontal line, and go a vertical line. And you're going to what's called palpate that. Okay? Just like that. The whole abdominal area. I did that in 4 areas. Sir, was there any pain there?
No.
Okay. You're going to press on the side. Any problems there?
No.
Okay. The next area is going to be the pelvis. Pelvis fractures are very, very painful. For all intents and purposes, this patient, if they had a pelvic fracture, would tell me that they have a problem. But we're going to check it in another way. Just going to basically come to the sides. You're going to push down, basically on the hip bones, and then you're going to push in. So down and in. If there was a fracture, even a slight one, that movement would cause the patient to scream in pain. And we know we'd have a problem. That's a very serious injury. The other thing, you're going to look in this area. What you're looking for is any blood, any urine, okay, any feces. Those are significant finds, and so you want to be sure to note that also on your paperwork. The next thing, I'm going to start with his limb. And you need to get inside of the legs. It's a little personal, okay, but you're doing an assessment on this patient. You're looking for other injuries. So, I'm going to do this, all right? See how I'm going back and forth, okay? Alternating the pressure. What that's doing is if there's any fractures in there, as I push opposing ways, it will demonstrate that. It will tell me that if he had a fracture. Okay, nothing there. Going to move to the other side. Okay, same thing, all the way down. Sir, any pain there?
No.
Okay. If you noticed, I did not cross over the patient. I didn't step over. That's not something you want to do. You want to go around your patient so you don't step on them. The next thing I'm going to do is, and I'm just going to note it right here, but I won't do that. I want to take his shoes off. And I'm going to pinch his toes. I'm going to ask him, sir, can you feel me pinching your toe?
Yeah.
Okay. What side of your foot am I rubbing?
The outside.
Okay, the outside. That's for sensation. Remember the PMS we talked about? Pulse motor sensory? Well, if there's warmth there, and he can feel that, then he's getting the proper amount of sensation down there. What I'm looking for is if it's unequal or he tells me he can't feel anything. All right, so I am done with the lower extremities. Now I'm going to move myself up to the arms now. Okay, same thing. Sir, be sure to tell me if you feel any pain. Any pain there?
No.
Okay. Okay, any pain there, sir?
No.
None whatsoever. Okay, the last thing I'm going to do. Sir, can I have your other hand? Squeeze my hand. Okay. What finger am I touching?
Middle.
Okay. And remember, you guys learn how to find a pulse. So I'm going to check his pulse. Okay, was there any pain there?
No.
Okay. So I'm looking again and listening for any pain, feeling for one hand not being as strong as the other, or not having any pulse, or the sensation, again, the PMS. So this patient checks out. He has no other issues. The last thing we're going to do is check his back. To do that, I'm going to grab another CERT member and have them help me do that. Alrighty, so I am now joined by another CERT member, and what we're going to do is we're going to demonstrate how to log roll this individual so that we can check his back. What we're going to do right now, though, is with just two of us doing this, and the assumption is that this patient, because he's conscious, and after our initial assessment of this patient, he told us that he did not have any neck pain or back pain, and all his extremities, all his PMS, demonstrated that we didn't have a problem. So we're okay with just two of us moving him over. So the way we're going to do is that, he's going to put his arms up on his side here, on top of him. We're going to cross. I'm going to grab here and here. My partner's going to go there. And on 3, we're going to roll this individual up. 1, 2, 3. Okay. Now you see I'm going to grab his head here. I'm going to check all the way down. Sir, are there any pain?
No.
Checking along his spine. I'm checking in this area. No pain at all, sir?
No.
Okay. This patient is fine. We didn't find any other injuries in his back. We can move him back down, but we're going to do this in a coordinated manner. So once again, 1, 2, 3. Okay. Okay, that now completes the head-to-toe assessment. The next section, I'm going to demonstrate how to put a patient in the recovery position. Welcome back. I am now going to demonstrate the recovery position. Remember, this position is used when we have an unconscious patient that is breathing on their own with no problems. So if they're breathing on their own, why would we do this? Well, we want to make sure that this patient, that if they happen to vomit, and if they're on their back and they were to vomit, they would aspirate, they would swallow, they would inhale the vomitus into their lungs. And that's not a good thing at all. That causes infections and pneumonia, and a patient could certainly die from that. So we want to avoid that. So again, this patient is unconscious but breathing appropriately on their own, and I'm now going to put them in the recovery position. Very simple. You take the arm that's closest to you and put that above their head. You then take the arm away from you and put this across their neck. Okay? The next thing I'm going to do is I'm going to take the leg furthest away, raise that up, just like that. And then I'm going to grab the patient here, I'm going to roll them over. 1, 2, 3. I'm going to position their leg like this as a kickstand. And then here, I'm ensuring that their arm is underneath their neck. This arm is up, and it's supporting their neck, supporting their head off of the floor, but their head is pointed down. So again, in case they vomit, the vomitus will run out of their mouth with gravity, and they won't inhale that. That demonstrates the recovery position.